Ever wonder how we measure the efficiency of our lungs? The answer lies in a series of terms and calculations that determine the overall health and functioning of this vital organ. Today, we delve into these terms, their definitions, and why they're crucial to understanding lung health. Firstly, we have total lung capacity, or TLC. This is the total volume of gas that can be held in the lungs after a maximal in-breath. For a healthy adult, this value is typically between 80 and 120% of what's predicted for their age, sex, and height. The importance of TLC lies in its ability to indicate conditions like lung hyperinflation or restrictive lung diseases. Then we have residual volume, or RV. This is the volume of gas that remains in the lungs even after a forced maximal out-breath. Like TLC, its normal value is between 80 and 120%. Understanding RV is crucial as it helps detect conditions like chronic obstructive pulmonary disease, where RV is often increased due to air trapping. Next, we have vital capacity, or VC. This is the volume of gas that can be exhaled with maximum force after a maximum in-breath. VC can be calculated as the difference between TLC and RV. VC is vital as it reflects the ability of the lungs to expand and contract and can be reduced in conditions like neuromuscular disease or lung fibrosis. Moving on, we encounter the FEV1 to FVC ratio. Forced expiratory volume, or FEV, measures the air movement in and out of the lungs. FEV1 is the volume of air that can be forcefully blown out in 1 second, whereas FVC, or forced vital capacity, is the total amount of air that can be forcefully blown out after a full in-breath. The FEV1 to FVC ratio is typically about 80%. This ratio is key in diagnosing obstructive and restrictive lung diseases. Lastly, we have the diffusion capacity of carbon monoxide, or DLCO. This determines how well oxygen passes from the alveolar space of the lungs into the blood. In obstructive lung disease, a decreased DLCO is seen in conditions like emphysema. In restrictive lung diseases, a decreased DLCO is seen in conditions such as interstitial lung disease. In summary, understanding these terms and their significance aids in diagnosing, monitoring, and treating various lung conditions. The total lung capacity and residual volume measure the maximum and minimum volumes of gas in the lungs respectively. Vital capacity reflects the ability of the lungs to expand and contract, while the FEV1 to FVC ratio helps diagnose lung diseases. Lastly, the diffusion capacity of carbon monoxide determines how well the lungs can transfer oxygen into the blood. Thus, these terms are the cornerstone of respiratory medicine, helping us breathe easier, one lung at a time.